Now it's time to talk about the super flu. They're surging across the nation and many people are reporting symptoms that are lasting longer and they're feeling really down and severe than usual. So Dr. Nighat is here with some advice.
Hiya, Doctor.
Hello.
Very nice to see you, Nighat.
Morning. Dr. Nighat, can you tell us about this so-called super flu?
Yeah, the super flu has been around for a little bit longer than we wanted it to. It's the same kind of flu that we get every year. It's the H3N2, and it's the subclade K, so it's sometimes termed as the K flu as well. It's basically a more virulent form of influenza A. So every year we get normal bugs, viruses, we get influenza, we get COVID, we get the winter diarrhea and vomiting bug, and this is part of that picture. But what's different this year and why it's been termed the super flu, it's come a little bit earlier.
Why is that?
Because I think the weather has played a huge part in that. I also think we haven't been sort of well prepared for it because we didn't think it would coincide with the weather so much. And then the uptake and the messaging, the public health messaging of go and get yourself a vaccine or stay indoors if you're still sick, that has just been delayed a little bit. So that's why we've had this surge of cases.
So every year is the H3N2, is it?
Yeah, we get variations of that. So we get the SARS virus, which is the COVID, it mutates, and every year we make a preparation for that. So that's why we say early preparation is so important.
So hospitalisation's gone up as well. It's a huge strain on the NHS.
Yeah, half, by 50%. And that's because what we're seeing is that, as I said earlier, people just weren't prepared for it in the way that we had to. So all that public health messaging that we had back in the pandemic of making sure you wash your hand, ventilate, these viruses are airborne. You know, if you're in a place and you've got your HEPA filters in, make sure there's good ventilation, coughing into your elbow, making sure you're coughing into a tissue, putting it into the bin, washing your hands, and masks as well. We have to think about making sure that you're protecting yourself when you're out and about, because sometimes the symptoms aren't there or they present, but people are still going out and about and mixing. And the other thing is, if you're unwell, stay indoors and self-isolate.
How do you know the difference then between, flu, COVID, super flu? How can you tell? Because the PCR test, when they do the testing, do they not just pick up on a range of things? Or?
They do. So you can have specific tests for like a SARS test or influenza test. So that's why we're saying if you're going to go to large gathering, again, all those public health messaging that we had before about getting yourself a test done is really a good idea. But how do you tell the difference between a cold and a flu and COVID? Well, colds, you can have early signs such as pressure on the ears. Symptoms appear a bit more gradually as well, so they can be more effective in the nose and the throat area, and this chestier mucus cough. So if you've got a background history of a respiratory condition, say COPD or asthma, my son has asthma, I'm always watching out for this mucusy, chesty cough, and the mucus has to be either green or yellow, or if you've got specks of blood, go and see the doctor. If you've got flu, it's a dry cough. It comes suddenly and you just feel exhausted and you feel wiped out. But also with flu, you get aches and pains and muscle joints. And then with COVID, it's your typical flu symptoms and then some. Remember with COVID, it's that loss of smell and diarrhea and gut-related symptoms with COVID.
So with the flu then, between a cough and a flu, you wouldn't get the mucus, it'd all be dry, would it?
Yeah, so with the flu, with influenza, we get a drier cough. So the cold is all up here, it's in your sinuses, you get that pressure, headache, pressure behind the ears.
And can you, like when people say when you actually get proper flu, you are bedridden.
Oh, yeah.
So is that the case for pretty much all flu? Like totally wipes you out, where
viruses,
you can pretty much carry on with it?
Yeah, viruses wipe you out because what they do, well, think of it, they override your immune system. So what they do is your immune system's so busy, and if you get a combination of those, and you've got an underlying complicated health condition like a cardiovascular disease or you've got an autoimmune condition, yes, you're going to be absolutely shattered and you have to take your time to recover. And the important thing about viruses, and this is why I keep coming back to the public health messaging from the pandemic, is that we also know that you get long-term impact on your immune system. So what we're seeing is a high rise in long COVID, long impact on autoimmune conditions, chronic fatigue. So we can't just be blasé about this. This is really serious.
Well, let's talk the flu vaccine. So who should get it?
Yeah, the flu vaccine has been offered. There's an SOS that's been sent out. Healthcare professionals, I've got my vaccine. Anyone that is over the age of 65, those with certain long-term health conditions, pregnant women, care home residents as well. And this is the key thing. We're trying to get people who are well and healthy to go and get a flu vaccine if it's possible. I know we've had a few issues with shortages in some areas around the country, but they are getting sorted out. So if you're healthy, then you can get one from your local high street pharmacist. I think they cost about sort of anything between £15 to £20, because what we need is lots of people vaccinated. Because with the flu vaccine or the COVID vaccine, when you're eligible, you get that. Yes, you will get the bug still.
Yeah.
It will make you feel rotten for a couple of days because what it's doing is building up your immunity, but you'll have the less intensity. So the impact means that you won't be hospitalised.
And then how long will it take for that to kick in?
So usually we say it can take up to 14 days for a vaccine to kick in. So please, if you're eligible, contact your GP surgery and get your vaccine.
Most people, they don't want to get it in the first place, right?
No.
So what
And
can we
that's
do?
where we've had the issues of this being far more intense and it's needing hospitalisation. And the pressure, the NHS system and the resources that we have is so fragile. My GP surgery, we're inundated with people who've got underlying health conditions who are coming in and they're absolutely poorly. But it's so important. I know at the moment it's really difficult because it's a festive season. You want to go out and about. Self-test, there's a couple of tests out there as well. So we know there's a Plus Life and also FlowFlex. Just a little bit, a careful thing here, because I've seen this with some of my patients, the online tests, there are fake ones around, unfortunately. Whenever there's a demand, there's scammers that will be there. So just be slightly careful and check with your pharmacy the test that you're using. And if it's positive, self-isolate and stay home.
OK. And if we want to stick with our natural killer T cells, what can we do?
Oh, yeah, lots of different things. So, as you said earlier about that chesty cough, and if you've got a sore throat, the trusted lemons, you know, warm honey and lemon, if you can, squeeze them in.
Yeah.
And also ginger as well. Ginger and turmeric, really good for boosting up your immune system. Your vitamin D, your calcium as well. Our trusty honey for that sore throat. Paracetamol, and if it's safe to do so, ibuprofen. Remember, ibuprofen, if you've got a chesty cough, can make your cough worse. So make sure that you're having ibuprofen and keeping that to the side, because we know, particularly people who've got a background history of asthma, the ibuprofen is not great, and all your lovely vitamins. Yeah. Hydration is key right now. And then making sure that you're self-isolating. Ventilation, I can't say that enough. Please ventilate your spaces.
Yeah, it says, but also stay warm, which kind of surprised me because, like, you say you don't get a cold from being cold.
Yeah, that is so true. But staying warm is so important. I think at the moment with cost of living crisis, people aren't putting their heating on. And so if you've got, say, cardiovascular disease, you know, staying cold will put added pressure on the immune system, added pressure on your blood pressure. So it's vital that we think about staying warm. And I would say, although it's a festive time, if the weather's not so great, you know, if you need to stay indoors, if you need to go outside, an FFP mask or masking at least so you protect others, because there's a lot of vulnerable people. And it's the intensity of those vulnerable people that are ending up in hospital at the moment.
Sure. Thanks,
Thank
Dr.
you.
It's great. Whistle stop, wasn't it?
Whistle stop.
Thank you so much for visiting our This Morning YouTube channel. We upload new content every single day, so go ahead and hit that subscribe button, and we'll see you in the morning.